All right. So this is what the Medicare.gov website should look like when you pull it up. It has all these blue tabs that all talk about different things, and then it'll have 3 green boxes in the center. But this is what you should be looking for when you go onto the website. Again, just be careful to always go to www.medicare.gov. Because when you type it in the Google search, a lot of times it's not the first website that comes up. So if a person wants to look at supplemental insurance, that's the optional coverage under original Medicare. To do so, they will go up to the top blue boxes where it says supplements and other insurance. When they click on that, then it'll say find a Medigap policy. And they can click on that, and then they can kind of search their needs. I will say that on Medicare's website, it'll give you a range of what the premiums are. It doesn't say exactly what the premiums are, but Maryland Insurance Administration puts out a great catalog every year that has the actual premium amounts for their plans. Now, when you call them to sign up, they'll be like, you get a discount, and you get a discount, and you get a discount. So it might be a little bit different from what the book says, but it's a good baseline. Keep clicking the wrong thing, sorry. All right, and now we're gonna get into enrollment review, because I haven't thrown enough information at you guys yet. All right, so the first thing you'll do, go to Medicare.gov, and you're going to wanna click on the box that says Find Health and Drug Plans. Important thing to note, do not push the back button once you've entered the plan. If you push the back button up where the arrow is highlighted and X'd out, this is what will happen. You'll be really upset. You'll lose all the information you worked so hard to enter and pull up. It'll all disappear, and they do it as a safety measure. So there are boxes that say return to previous page or something along those lines. And you'll see them, and that is where you'll want to click to go back to the previous page. So we're going to click Find Health and Drug Plans, and then it'll bring you to this page where it'll say General Search or Personalized Search. So we're going to, for all purposes, we're going to scroll down and do the Personalized Search first, and then I'll go back and show you through the Generalized Search. So information you should have before logging in is the beneficiary zip code, Medicare number, which is on their red, white, and blue Medicare card, their last name, make sure it's spelled correctly. If they're a junior and senior, that's also important too. Their Part A effective date, which is also on their red, white, and blue Medicare card, and their date of birth. Other things, a list of their prescriptions, the name, the dosage, and how frequently they're taking them is also information that you'll need, and their pharmacies. We always ask for 2 because we can oh, sorry.
I have a question.
There's a question.
Before with one of the clients, but when I put the Medicare number in, I know you have to put A. In this case, I had to put DC, and it caught me off guard, and it took me a while. Why is that? Because I never seen it before.
So there are a bunch of different letters. There's T, there's D1, there's a bunch of different letters. They all relate to something. Oh, it's in your packet?
Second packet.
In your second packet?
Second packet, okay.
There's a list of the letters and what they mean.
Okay.
That's in your second packet. So yes, be sure, don't just assume it's an A, or don't just assume it's their social with an A. Really look at their card, because sometimes it's not their social,
Okay.
or it's not A. Oh, sorry. For those of you that were like, what? Sometimes on the Medicare card, their Medicare claim number is not their social with an A. There may be another letter or number associated. So always be looking at the red, white, and blue Medicare card. Okay. Was there another question? No? Okay. Any questions from there? Nope. Okay. All right. Okay. If the screen comes back saying no records found, verify all the information, the zip code. Sometimes if a person has recently moved, their zip code with Social Security is still their old zip code. You should try using that zip code because a lot of times it may be that zip code. I've had people where it's like 5 houses ago just because they haven't ever updated their address. So make sure you're asking them for their zip code. Again, junior and senior can really throw it off. And their Medicare number, if we've typed it wrong or whatever the case may be. And then this is an example of what their Medicare card will look like. Okay, so once you've entered all that, you'll click Continue to Plan Search. It will be a button at the bottom of your screen. And it'll pull you to this page where you will enter your prescriptions. And there's a box down here that you can start to type in, and it usually auto-fills whatever you're trying to type in. It'll bring down kind of a drop-down menu with options, and you can just select it. The other thing to note, this is really, really important to emphasize with your clients too. If they're not taking any drugs, they should still get a prescription drug plan. A lot of them will be like, why? What's the point? Why am I going to waste the money? Because if they need it later, which tends to happen, they will get a penalty if they try to sign up later on to get a plan. So we always emphasize that even if they're not taking any prescriptions, they should still get a plan to cover them when they may have to take prescriptions. Again, you can emphasize that. If they choose not to do it, that's their own option. But I just wanted to say that, and you'll just click I do not take any drugs if that's the case. I'm sorry. We might actually go into more detail on these, and I'm talking about them. Do we have any questions? Oh, sorry.
For Plan D, right?
Yes, this is for plan, looking at, well, yes, but you can also look at Advantage plans too through this. So it's kind of both. And I'll talk about that. The question was, this is just for Part D. No, this is actually for Part D, and you can look at Advantage plans too.
Kirsten, just to point out a couple things, I'm not sure if you want to talk about it, so I might be jumping in when you were already going to say something. But on the upper right-hand side, you see that My Current Profile.
Ah.
That should look familiar to the person if they're sitting with you, because that will show you what their current coverage is. And also, if you've worked with them before, like we get people that might come back to our office, or we might be working with a client year to year, and they may come back to us and actually have their drug list from the previous year, and we never have they have saved all that information, so we can log in right back to that. So that middle right tab or box is actually where that information would go in. So the drug list is kind of like their username, for lack of a better explanation, and then the password is the date that they saved their information for. And we talk about a tip for changing that to something a little more easy to remember. But just, you won't see it if it's not them, but it's just kind of a reinforcement that you know then what their current coverage is.
Okay, I'm going to repeat for the people that...
I think he got it. Did we get it? We're good.
Did you guys have Ready Grace here? Okay, I'm going to repeat it just to make sure everyone understood it. So in the upper right-hand corner, it'll say My Current Profile. And if a person is already enrolled on Medicare and we're just looking to see if their plan is good for the next year or they need to change, that upper box that says My Current Profile will say the current plan that they're in. That way you can just confirm with the person that we've entered the right information, this is really their profile. And then also, if someone didn't have their Medicare card with you the day that you met with them, when you do the generalized search, there'll be a drug list ID number, a zip code, and a date of entry. We usually change it to the person's date of birth to make it easier. We'll go over all that once I go through the generalized search and do that with you. I'm going to do that like live action, like really showing you what it looks like. But we just wanted to touch on that so everyone knew that's another way to just verify that you're looking at the right person's plan. Okay, Oh, congratulations. If you got to this page, you did it correctly. Okay. This is a sample of once you've entered a prescription. Did I go too far?
Your head one.
I am? Okay. Oh, yeah. Okay. I flipped my page, so I was on a different slide than you guys. Okay. So, oh, wait. I just basically said all this to you guys. But, okay. If a beneficiary has used Plan Finder before, it's possible that they will have an existing list. That's helpful to you guys because you won't have to re-enter their prescriptions. You can just add or take away if they're not taking anything. I always cross-check with a client if they're still taking the same medicines because a lot of times they change. Also, even if they say, oh yeah, I'm still taking levothyroxine, check the dosage with them because a lot of times it can go up or down. Just simple things to keep in mind. And as you can see where that big green box is on this slide, that's where their drug list ID number and zip code and date of birth would be. We just blocked it out for this purpose. All right. If a drug list does not exist, what you'll want to do is you're going to type the name of your drug. So a lot of times people will tell you the brand name of a prescription. We always ask, can you take the generic form of that prescription, because a lot of times the generic form of a prescription is cheaper than a brand name. So just be sure to be checking each time you're entering a prescription. If you're entering, for example, Synthroid is a great example of a brand name prescription that a lot of people can only take the brand name form of it. If you put Synthroid in, Medicare's website will automatically alert you to let you know that there is a generic available. So just so you know, the box will auto-complete the prescription. You can just select it, and then a box with the dosage will appear. And it'll say 50 milligram capsule, 50 milligram tab, extended release, which is usually abbreviated to ER, solution, gel, cream, topical, whatever the case. It'll list it in whatever form it comes in. So then you'll just add the drug. There'll be a box that'll say add drug, and then it'll be added to the list. And you can add up to 25 prescriptions. So this is example of, again, Synthroid. That's our best example, apparently. Synthroid, showing just that it comes in tablets, the different micrograms that it comes in, and then in the middle section is the quantity. So if a person takes the pill twice a day, you would put 60. 3 times a day, you'd put 90, 4, 120, and so on like that. So a lot of times, for just ease of the website, I usually put everything in a 1-month supply. I know a lot of the clients we work with do 90 days. Mail order is an option is automatically on the site already. I just do it in a 1-month supply because a lot of times if they see the 90-day order, they're like, what am I paying for? So it's sometimes easier to read in the 1-month supply, but all of you are going to learn the way that works best for you, and that's going to be great. And then it says, do I get this through a retail pharmacy or mail order? And I usually just keep that as retail because mail order comes up automatically already, so you don't really have to do it that way if you don't want to. Okay, and like I said, the box will come up that says that there's a generic drug available, and then you can select either the generic or you can select the brand name. And then back to the drug list ID number. Up in the right-hand corner, there will be a box that says drug list ID number and password date, which is usually the date that you're entering the site. We change it to the person's birthday because a lot of times they don't forget that date. Are there any questions? I feel like I'm flying through this. I do this every day, so not every day. 2 times a week, but a lot. So if I feel like I'm talking really fast, I apologize and stop me or slow me down. Question?
I guess I'm sort of confused, like, what the purpose of entering all the drugs into the website is. Is it so that they can, like, find out what plan would be best for their drug or?
Yes, so the question was, what is the purpose of putting in all the medicines into the system? So the purpose of putting them in is to, A, find out how much their costs are going to be for the prescriptions, and then also it's can be utilized to search and see what pharmacy is going to be best. We always try to help people kind of see cost effectively what plan is going to be best for them. But it also depends on the pharmacy they're using. I have done this many times where the pharmacy that they are used to will cost them thousands of dollars, but switching to a different pharmacy could cost them $100 in the grand scheme of things. So it's really important to be looking at pharmacies also. Another thing I just want to touch on, it might be in this packet, but a lot of times families, if they're enrolling around the same time, they want to be on the same prescription plan. It usually, there are rare cases, but usually it doesn't work out that way. The prescription plans are tailored to the person's medicine. So a lot of times individuals are in separate plans because it's cheaper for their medicine on a different plan than it would be to be on their significant other's plan. So that's something else to just let them know, like, it's okay to be on different plans for your prescription drug plan. You can be on the same plan for your supplemental. So,
And just as
Oh.
a side note
Oh, yeah.
concerning the pharmacy, sometimes when you put the prescriptions in, and if you look at a local pharmacy like a mom and pop shop, sometimes on the plan finder, it might show it the thousands of dollars, but a lot of times the mom and pop shops around here will honor, especially if they've been with that client for a long time, they will honor that, the cheaper cost. So, but some of the mom and pop shops, when you put them in there, are very competitive already in terms of lower cost,
so Ann was just commenting that some of the smaller pharmacies, the mom and pop shops, when you put them into Medicare's website, might show that they're thousands of dollars, but if they've been working with a client for a long time, they may honor their plan and the lower price of the prescriptions. So sometimes you should tell people to also talk to their pharmacies that they've been using just to see what it would look like as well.
Kirsten, and just to go back to your question, really what we're focusing on today is simply Part D and some information on the Advantage plans, because we have open enrollment coming up, which is the time period where that's the window of opportunity that people have to change their plan. In the majority of cases, if they do not change their plan in this window, they cannot change their plan. There are some exceptions, some programs people may be enrolled in that will give them another enrollment opportunity, but for the most part, if you hit December 12th and you haven't done your Part D, they're going to roll you over into whatever it is you had before. So that's why we're really focusing on this, because of the timeliness of the annual enrollment period. And we'll talk a little bit about some of the subsidy programs that allow for special enrollment periods.
I mean, it's also very important for them to look every year, because the plans change, premiums change yearly, their formularies change yearly. So what may be covered at a good rate under one plan this year may not be so good next year. So that's why it's always good to have them at least go through the motions of checking. They may not change their plan, but.
So we were just going back to talking about the importance of today and what we're doing today, and just because open enrollment is coming, and we're hoping that some of you may be able to help your clients look at these plans and kind of navigate the system. And then also, it's important every year to be looking at the plans, because premiums can change, deductibles, those are a big thing that change. I know when I first started, there were a lot of plans that didn't have deductibles, and now almost every single plan has a deductible. There's only a couple that don't. And then formularies change. So they may have covered a prescription for 15 years, and now they're not covering it anymore. So it's always important to be looking kind of at all the aspects of the plan: formulary, premium, deductible, copays. Okay. Okay, so like I said before previously, that we always pick 2 pharmacies. That's all the system will allow you to look at a time, is 2 pharmacies, and then mail order comes up automatically. We pick 2 pharmacies just to show them that they have options and it may be cheaper at a different pharmacy. When you're on this page, let's see if I can actually use this little clicker. Laser pointer. Do you guys see this little tiny box right here? That is miles from their zip code. So we always expand that out as far as it goes usually to look at all of the pharmacies in their area. If they say, I go to the CVS on, I don't know what road, Main Street, Churchville, thank you. It's okay if you pick CVS in Forest Hill or whatever. All the CVSs are going to be the same. So it's okay if it's not the exact address. But we pick 2 pharmacies as an option, and then you can click to continue.